So with that, I'm going to kick off the Mental Health Roundtable. So for the Mental Health Roundtable, just so you know, nearly 450 million people worldwide are currently living with mental illness, yet nearly 2/3 of those people of known symptoms never seek treatment. Mental and behavioral health issues must be treated as a disease, not as a weakness or personal failure. Our pandemic experience has brought additional attention to this important topic. So now join us as we explore the facets of mental health challenges, their solutions, and public awareness. So with that, I'd like to introduce Laura Blank. Laura Blank is the Senior Policy Associate at Wellbeing Trust, an organization that has been focused on both bringing awareness and solutions to the mental health space. She served as the public policy lead in the State Health Center for Policy and Performance. She's had 15 years of experience in health policy analysis and is working to transform systems and social structures to improve mental health outcomes. Laura, welcome. I'm sorry, that's been like a fire hose. I kind of thought I'd try to pace that down a little bit, but we're trying to stay on pace here. So Laura, so thankful that you could join us. Could you tell us a little bit about your experience with that state health department and what that taught you about applications and bringing together all of these solution providers across the ecosystem to try to address some of these problems?
Yeah, absolutely. Hopefully everyone can hear me and see me okay. Thanks so much, Mike. And thank you for inviting us to be part of this amazing panel today and for addressing this really critically important topic. I think, to answer your question, my training is in public health, and I've had the opportunity to work across a variety of settings. I've worked in the HPV and Cervical Cancer Research Center with the American Social Health Association. I've worked in HIV case management in the Bronx. I've done health policy work with the Texas chapter of the American Academy of Pediatrics to promote policy that focuses on children, family health, and the practice of medicine. And in the state agency setting, I've played a variety of roles, including within the Medicaid program, within the public health department in Texas, doing program operations and various public health policy. And I've been very fortunate and had a lot of exposure to sexual health, children's health, Medicaid. And the one common thread that runs through all of these experiences really has been the extreme need for mental health services, as well as the complexity with addressing those needs and the barriers to care. And so, I came to Wellbeing Trust in May.
Just a moment to that. Like, what do you mean by a common thread? Why is it a common thread in these different issues?
Even when you're focusing on, and I'll give you an example, when I was at the HPV and Cervical Cancer Research Center, and this will date me a little bit, but it was before there was a vaccine for HPV. So we're going back 20 plus years. We had several STD hotlines, and two of them were focused, one on herpes and one on HPV, and people would call in. And our job was to provide information and facts about HPV and help people connect with medical services if that's something that they needed to do. And through the course, I worked a lot on this line, and through the course of many weeks, I noticed that there was somebody who called every single day.
They were just looking for attention at some point. They needed help, different kind of help.
They needed help, and it wasn't about HPV because I had given them the same information every day. They needed somebody to talk to. They had stress, they had worry, and it wasn't something that was being addressed in any other way. So they called. And there could be a variety of reasons for that, right? Like, it was anonymous, it was safe, it was comforting. And, after a while, my boss was like, you really have to find a way to move this person along. And I was like,
I don't want to.
If it's helping them, that's right. What we're here for. And so, you see that across a variety of things, doing HIV case management. We were focused on making sure people were getting to their medical appointments and taking their medications. But the truth was, what they really needed was somebody to go with them to their end of life planning, because it was too much for them to handle alone. And so, despite the focus of different things around, sexual health or children's health or infectious disease, there is always a mental health component. I think, Mike, when you and I had a chance to talk recently, we talked about mental health and well-being being broad, because it really is everything touches your mental health, your relationships,
and vice versa.
yeah, and vice
between the
versa.
two, which is reflective throughout the entire issue.
Absolutely. And so, when I came to Wellbeing Trust in sort of the beginning of the pandemic in May of 2020, I knew that there were needs. I had experiences in every setting I had ever been in that really underscored that there are underlying things here that we need to address, to really move people from a place of need to flourishing. And so at Wellbeing Trust, that's kind of what we're focused on doing. And I'm so excited to be part of this panel today and hear from others to talk about, what some of the solutions may be as we move forward to address these needs together, because we have some ideas, and we certainly work with a variety of partners to address the needs that we see. And a lot of the work that I do now is kind of focused on policy. But I think, if we've learned anything through the pandemic, it's that a system that was struggling prior to COVID has really been exacerbated, and there's more need and more demand, and we really need to find innovative ways to.
So if I had to ask you in just a few sentences to try to give me a shot of our audience, like what they should be keeping in mind as they hear this conversation, like something that would make them sit upright, whether it's statistics about mental wellness, whether it's issues about like post-crisis care or preventative care, like what do you want them to keep in mind?
Yeah, I mean, I could sit and I could reel off the statistics that we have around folks, having barriers to access to care. We could talk about the stigma that people feel in even engaging in a process of care. We could talk about the deficiencies, but I think what we want to focus on at Wellbeing Trust is that the opportunities that we have in front of us right now have not existed in a way that they've needed to, but haven't in many, many years. And I think, COVID has been awful for everyone.
Yep.
But it also has underscored this need and almost normalized, saying, I need help. I'm struggling. I can't do this by myself. I need to talk to someone. I need a different way of addressing my anxiety, my stress. And so I think, people are taking notice of that, and whether that's through funding at the federal level for certain programs, or, just, within our communities.
Sure. So that's great. That's a wonderful way of looking at it. Let's not worry about we could call out all of the problems, which we will, but let's also try to focus on the fact that we want to provide some solutions. And so I'm going to put that to our panel in a little bit as we bring them on, that let's try to focus not on creating these concrete priorities, but focusing on what types of solutions, given our opportunity set at this time. I'm going to ask Karen Zuckerberg to join us on stage. And while she does, maybe if you could give us one last parting shot on what your biggest, if you had a favorite solution, what would it be?
Oh, wow.
Like a wish list, a wish item.
Yeah, a wish list.
Says, this is a product that I can give you, Laura. Like, what is
Yeah.
it you would want?
Oh, Mike, that's like asking somebody to say what their favorite song is.
You pick your favorite child. That's no big problem there.
I only have one, so she's my favorite.
Oh, so that's easy for you. So perfect. Okay, great.
But no, I mean, I would say right now, one of the things that we really need to do, and I mean, for me, being in public health prevention and sort of the upstream solutions are really important to minimizing the more intensive need we see as people kind of move through that continuum. But I mean, for me, I think because we've identified that there is so much need right now, and we have a real opportunity in 2020, Congress authorized a 3-digit crisis number 988, and it will roll out in July of 2022, which is almost here. And yet there has been very little guidance or planning around implementing services at the local level to address the needs that
So
the
your
existing need.
biggest request would be, how do we tie together a high quality, top level mandate with actual operational delivery of that solution?
Yeah, getting those services embedded in communities across the nation
No,
so that we connect things.
That's a worthy request. We'll see if innovation can help with that aspect. Karen, thank you so much for joining us. I'm going to move to the side here and allow you to step in the lead. But so Karen and I have had conversations on this topic a number of times. She actually wanted me to give her a set of questions on these speakers in order to guide them. I'm like, no, Karen, that's not the way this is. This is open-ended. This is scary. This is seat of your pants flying here. We want to know your opinions on this topic as much as anybody else. So Karen, if you had a priority set, thinking about what Laura's just discussed and what her priorities are and what they're working on, I assume that you approve of many of them, but that's because mental health is such a wide area that you can have lots of favorites. What would you want everybody to be focusing on?
Well, absolutely. I think Laura brought up so many wonderful points. First of all, that mental health it starts in the family and it affects the entire family unit. If you have children with disabilities or autism, people who have suicidal ideation, or people who have substance abuse, this is going to affect the entire family. And there has been such a stigma attached to mental health and to seeking services that I think that trying to bring, community and telehealth to more people so that there can be more discussion and awareness that it's an ongoing problem for many people, that people aren't alone. COVID made many people feel that they were isolated and brought up a lot of anxiety and further increased depression. And having community is really important. And I know that, as you said, Laura, that they're implementing crisis coding so that telehealth can be implemented and used more. But there are also concerns on the parts of physicians that they will get reimbursed less. So this is something that I think needs to be addressed, that we're going to be able to address the needs of the people without the physicians having to worry about whether or not they're going to be reimbursed and how that's going to come about.
Excellent. So like if you had I'm going to ask you for the wish list item also, and then I'm going to step aside and bring the rest of our panel speakers on, and you can speak with them and everybody can start thinking about this together. But if you had a wish list item, Jeannie comes and gives you the item. What is it? What's one-off solution would you wish for right now? Your favorite child, so to speak.
If my wish list solution would be decreasing the feeling of isolation that people have in terms of seeking mental health care.
Excellent wish. All right, with that, we've got Unity Stokes here and also Rich Melcomb. So Unity is the founder of Startup Health. These guys have done an amazing work, and they're currently holding the world's largest portfolio of healthcare innovation companies. We've been honored to partner with them both via the Alpha Partnership and the Impact Partnership, and I've enjoyed many of our conversations together on these topics. They are on a lifelong mission to improve the health and well-being of everyone in the world. Well, that's not a small goal there, is it? Just, are you sure you're shooting high enough? You're trying to improve the well-being of everybody? All right. Well, what? Shoot high.
We'll get into that.
Right? Excellent. And then Rich Melcomb. Now, Rich is a character. I love this guy. He is a TV and movie producer, and he's worked on television commercials, a number of other things. But what he's done most recently, which is really cool, is he's been partnering up with gaming companies to integrate into the Gamers Network, these electronically connected gamer networks. And I think what's most revolutionary is their attempt to create a social network, a microstructure social network with peer-to-peer support and other mental care services via their Vent program. With that, I hand off to you guys, and I'm going to just give you, like in Coffee Talk on the old Saturday Night Lives, topic for discussion. You can open with what your biggest priorities are, because remember, the first part of this session, we're trying to create concrete priorities. What would you focus on most first off? I'm going to ask you, Unity,
Yes.
first, since you have the ability to put dollars to work.
All right. Well, it's wonderful to be here. Thank you, Unity Stokes Startup Help. I believe we need to be thinking about this at scale for the world. So what I mean by that is a health moonshot for mental health and well-being. We need to inspire a generation of thousands of innovators, thousands of entrepreneurs, and thousands of investors around the world to be focusing on such a diverse range of ideas and solutions and innovations. So I don't think there's any one thing specifically. I think a whole generation, a whole ecosystem approach, and globally. I think there's so much need around the world, region by region, that we need to be focused on at scale. So more entrepreneur and innovation and more capital to support them.
I absolutely agree. And as you know, VC funding for mental health was $14.7 billion in all of 2020. And they have given just that much money in the first half of 2021. Rich, what do you see as the overarching issue for you?
Well, first off, let me explain what Vent is. Vent is a vertical, if Richie knows, which is a social network for gamers. And we did an alpha test in Los Angeles last summer, and Vent was outrageously successful. And what it is we just listened to people, and they came to speak their truth. And so what Vent is community-driven mental health solutions. And that's what worked for us. And going into our test, the research showed about 82% of all gamers were unhappy. During our test, we couldn't find a happy person. What we discovered is America's in a mental health crisis.
Mm-hmm. Were there things that you were finding they were particularly unhappy about?
Absolutely. Gaming is huge. I love gaming. And Richie knows is a place you go when you're not playing a game to connect locally. Mm-hmm. The idea of Richie knows is in every market, every designated market area in the US, at least the top 30, there'll be a Richie knows and there'll be an event. Because I believe mental health is also local. And the idea that you can connect with like-minded people locally allowed people to, again, share their truth in a way I've never seen before. In television, I had a marketing company, and my skill was emotional engagement. So we saw things that many of us on our team had never seen, and that's people just. They don't want to be in virtual worlds all the time. They want to be in a real world and connect. And I can go on, but.
Well, that is definitely one of the issues that COVID has brought forth is the increasing feeling of isolation that people have had. And just the loss of camaraderie at work and getting together with people. So how do you see, do you see in terms of community incorporating groups, or do you see this more as an individual process?
Well, during our test, we produced about, we did close to 12 hours worth of programming. And we tested, our whole alpha test was focus group. It was live, 720 hours of live testing. And we did support groups, mental health journeys, relationships and love, and what we called overheards, just people discussing a mental health issue. And Karen, what we discovered was no matter what we branded, it was when people came in to watch the show on whatever, they came in via Richie Knows or they came in via YouTube or Twitch, it turned out to be whatever was on their mind and what was coming from their heart and what was troubling them. And what we discovered was, people started off, with a brave face, but in every show we had, there were tears shed. And I do believe one of the greatest values was the idea of being in a community that they were passionate about with gaming. So there was an element of trust.
Mm-hmm.
What we had was, when people explained what was going on in their life, it was the community that acted. And then we had a mental health expert standing by. We partnered with NAMI nationally and NAMI Westside Los Angeles. So we had experts available. And so what distinguishes us from almost any other platform was the person sharing their story with other gamers or like-minded people, and then having an expert stand by to answer questions only if asked. And what was interesting, we flipped it. As opposed to an expert coming on and telling people what was wrong, there was zero judgment, and it was beautiful.
Laura, do you feel that in terms of your experience, that the same aspects of community have you have noticed that?
Rich, thank you for describing the work that you're doing, because I think it's so interesting and important. And I'll say, from our perspective, and a lot of the work that we do is really about empowering networks and support where people are, wherever that is. And I think, we've talked about the role of technology and some of the concerns with technology, but I think the truth is, we need to make mental health and talking about mental health and empowering people with the skills that they need to help themselves and help others navigate mental health needs. We need to make those accessible wherever people are. And so one of the things that Wellbeing Trust is really leaning in on right now, when we're working with a team out of Harvard, is this idea of community-initiated care. Mm-hmm. And I think, that can be a physical community, but it can also be an online community. I mean, I think we have definitely run into certain populations who, may live in a place where there aren't people like them, and they really gravitate towards some of these other platforms to find their community. But the idea behind it is that while it's wonderful that you have a mental health expert there to respond to need, what we want to do is empower everybody that's in that room to understand, to recognize that there's a need, and to be able to provide support in the moment to a friend, to a loved one, to themselves. And so it's really this idea about task shifting and unity, going back to what you were saying about sort of this global focus. I think we've seen this idea of empowering community members in other countries because they don't have the same medical resources that we have here. And how can we find a way to really bring that into the US and support people, wherever they are with that need, whether that's in a community setting, at home, or online.
I agree with you completely. What are your thoughts on this unity?
Well, I think, given we're talking about a universal issue to all humans, one of the interesting things that I think is happening as we look around the world is the solutions that are being created. So if you look at just a country like India as one example, well over 1 billion people, and there's like 1,000 or 2,000 psychiatrists that focus on mental health for 1.4 billion people. So what's emerging are new approaches that I think are just at the very nascent stages, but I think there's a big opportunity to be thinking and looking at different regions around the world, not just here in Silicon Valley. I'm in Berkeley, but all throughout the United States, but all throughout the world. And I think to be thinking about the possibilities for solutions in a much more diverse way than we've been thinking about mental health. So one quick example, we have about 33 companies that we've invested in I hope one day that's 30,000. One company's focused on people of color, a company called Hurdle, emerging company called Genève, focusing on women going through menopause, a company called In Recovery, focusing on people with addiction issues. I think each of these are completely different needs. And so if we can inspire a generation of thousands of innovators and solutions that we can back as a world community, I think we can make more progress.
I think you bring up a lot of interesting points. First of all, I agree with you that we can learn a lot from other countries, emerging countries. We have an enormous number of provider shortage issue in many areas of this country, specifically in rural America. There are very few psychiatrists to render care. And so we are faced with telemedicine as the only way that people are having access to any kind of care. So I think, and also there are a lot of startups now that are focusing on communities, bringing people together in group settings. That's been common in weight loss in the past. But I like the fact that you're bringing up many other aspects that this can be used. Rich, how does this go back into what you were saying in your own community?
You were having echo.
Oh, I'm sorry. I think I was having echo. The question is, we were discussing how communities and groups were, in terms of eating disorders and substance abuse, have been very prevalent in the past. And what Unity is talking about is increasing community in many other different aspects of mental health care. And I was wondering how you saw that pertaining to your particular industry and what you're seeing in gaming.
Oh, no, absolutely. You know, Unity, what you mentioned, imagine on a micro level that we're able to connect people to whatever is troubling them. It might be as simple as you having a bad day to an eating disorder or depression or anxiety or whatever the issue might be. We had the ability when they came to Richie Knows, a combination of NAMI and our own team. We had about 26 people working with us on our team. You could go in and check any issue and get information. And we rewrote some of it for younger people. If you read a lot of the information, it's tied to older people, and it wasn't tied to younger people. But then in our support groups and our video, our live shows, you know, people literally connected with each other and would have private conversations. And you know what our whole goal was leading with heart and empathy. And when somebody has a problem and somebody else understands it, it's a natural connection and more of a validation. And so to be really specific, we have the opportunity to do every kind of nuance of mental health because, you know, as you know, with the digital platforms, it's unlimited of what we can do within the community.
So it sounds like moving forward in terms of a possible solution, or it might be increasing community to increase awareness and to increase access. So Laura, how do you, everyone's shaking their head, and I'd like to know what your thoughts are on how you think that we could move in that direction. Laura, would you like to start?
Yeah, sure. I think for us, you know, we are really investing in this idea of task shifting and thinking about how we can leverage resources within these communities. You know, that includes peers. Sometimes we have great networks of community health workers at some places, but really even going a layer deeper into our general population and working with communities to identify what their unique needs are, because we know, you know, that's going to vary, and providing them with easy ways to learn, act, and organize around supporting mental health need.
So this is great, guys. This is really good. I think we've got three very solid points, and Karen, you very well, you elucidated them pretty well already. But essentially, rather than focusing on the the indications or specific problems. Let's deal with how do we improve the community in terms of peer-to-peer support or lessen feelings of loneliness and feelings of increased interaction. How do we increase access? And then how do we increase operational support so that fewer therapists or fewer licensed individuals can service a larger population, which feeds back into a lot of different things. I'm going to suggest those as being priority sets, and I'm going to throw it back to you for the last 5 minutes here in terms of adding refining points to that in terms of how would we define that to solution providers?
Yes, I'd like to give each of you an opportunity to address that. So why don't we start with Unity? Would you like to start with how you feel that these major issues should be approached?
Yeah, I would say the first potential solution to these priorities, I think, is as we use words like innovation, we should think more broadly beyond just technology innovation. There's business model innovation. There's design innovation. There's innovation by region, by different types of people. So I think we should be very thoughtful and hopefully create awareness for the innovators out there that there's all types of innovation in this area that we could and should be backing. The second, in a very practical way, I would say there's a new wave of innovators creating things today. This is very good news. And I think we could all, in different ways, support these people, these teams, these companies, whether it's through partnership or investment or just sharing their ideas with the world. There's a new generation emerging, and in very practical terms, if everyone just finds one of these innovators and supports them in some way, I think we can start to speed progress up.
I think that's an excellent point. One of the challenges is how we introduce and we make these innovators, people aware that these innovators are out there and that they have these wonderful ideas. Do you are you helping to do that?
Yeah, we're investing every quarter in new companies focusing in mental health. So we're focused very early stage. We do that. Anyone could go to healthmoonshots.com and see how we do that. We love to welcome everyone into our mission. But I think that you hit the nail on the head. We've got to open up and create understanding and awareness and connect the world with these people in very easy, accessible ways. And I think that's starting to happen thanks to technology and thanks to platforms and thanks to new ways to create access.
Yes, certainly technology has opened up a lot of opportunity for people in all areas. Laura, let me have your some of your concluding thoughts here.
Yeah, I love what you said, Unity, and I think it's so important. You know, one of the things that we are really focused on is making sure that we're listening to the people who have needs. And so, you know, when me at 44, after 20 years in public health, I can't sit in a room and decide what youth need. They need to be at the table. They are the ones who are able to communicate about those needs and are oftentimes the ones who have the solutions that you're speaking of. And so really making sure that we're looking across different populations. And, you know, I mean, for us, this applies in everything, the data that we're collecting, the investments that we make, but really making sure that the solutions that we design are made to meet the needs of the people who need them. And so making sure to incorporate those voices at every stage, I think, is something that is really critical.
Absolutely, Laura. I think what you're saying is so spot on and so very important. And Rich, how do you see, what would you like to say in conclusion in terms of your positive attitude out there?
Well, I got to tell you, it was so special doing that. For us, it's destigmatizing mental health and giving people a voice and validating and communicating and listening in a way that they want to. We had no preconceived notions going in. And when we ended our test, everybody was there. And, you know, in a really strange way, everybody's a mental health expert if they just listen, and then you could funnel people to the right place to go to get additional help. Our vet is a place to go, one, to acknowledge you have something that you feel different about, and then depending upon what your needs are, to go through NAMI locally or different local providers. But for us, it's about destigmatizing and reimagining mental health.
Absolutely. Destigmatizing mental health, gaining more access, increasing innovation. All of these are so important. I want to thank everyone. Unity, Laura, Rich, you've been a wonderful panel. I think you presented lots of challenges and lots of excellent ideas as far as where we can go from here.
And I want to thank you, Dr. Zuckerberg, because you were an excellent host here. This was fantastic. Great panel, everyone, and thank you all for joining us today.